Auditory steady state responses ASSR. Auditory steady state response ASSR has been suggested as a tool for hearing assessment for children. Auditory steady state responses are scalp recorded. I repeat, auditory steady state response are scalp recorded potentials elicited in response to sinusoidal amplitude or frequency modulated tones. The response is periodic or continuous and phase locked to the modulation envelope. As with ABR, auditory steady state response ASSR can be recorded at low levels in sleeping and sedated subjects, including infants. There are several reported advantages to auditory steady state response ASSR measurements. First, the response is elicited by a modulated pure tone. Thus, the stimulus is more narrowly defined in the frequency domain compared with gated sinusoids or clicks. However, it is important to remember that once outer hair cell damage exists, which occurs in most cases of sensory hearing loss, the extent to which narrow cochlear region can be excited is reduced. This is probably the case for gated tone bursts in quiet tone bursts presented with a noise mask and even for pure tones. Auditory steady state response measurements also lend themselves to automatic response detection. Such a feature is attractive in that it avoids problems associated with the experience and expertise of the observer. Finally, it has been suggested that auditory steady state response measurements have a wider dynamic range than ABR measurements. That is, because of the stimulus's long duration, higher levels can be achieved with auditory steady state stimuli in units of hearing level compared with the case for the brief duration rapid onset stimuli that are used with ABR measurements. The results of one study shows that auditory steady state response thresholds can be obtained reliably at various frequencies for children with severe to profound hearing loss. I repeat, the results of one study showed that ASSR thresholds can be obtained reliably at various frequencies for children with severe to profound hearing loss. The study also shows that ASSR testing is superior to ABR testing for the evaluation of hearing level in young children. Obtaining threshold information at these elevated intensities is becoming increasingly relevant in the light of reduction in age of patients undergoing cochlear implant and the inability of other electrophysiologic procedures such as ABR to assess residual hearing at these intensities. If the hearing aids for child with a profound hearing loss are not set at an optimal level according to actual hear threshold results, the child may not have had a true hearing aid trial. I repeat, if the hearing aid for a child with a profound hearing loss are not set at an optimal level according to the actual threshold results, the child may not have had a true hearing aid trial. From this point of view, determining thresholds for 0.5, 1, 2, and 4 kHz is very important. Furthermore, absent ASSR thresholds indicate no usable hearing. I repeat, absent ASSR threshold indicate no usable hearing, whereas absent ABR thresholds are not an indicator. Because auditory ASSR allows for better hearing aid fittings, resulting in true hearing aid trials, and absent ASSR thresholds predict poor hearing aid fit, the ASSR is uniquely suited above the ABR to assist in the assessment of young children for cochlear implants. Several researchers have reported that auditory steady state responses may be advantageous for the estimation of hearing threshold for children who have no responses in ABR to click stimuli. Now, this suggests that auditory steady state response may provide a measure of residual hearing in young cochlear implant candidates by providing estimated thresholds to frequency specific stimuli presented at high stimulus levels if needed. According to one study, the results show both ABR as well as ASSR techniques may be used to provide an estimate of hearing sensitivity in children. If a child has no response ABR, some thresholds have been obtained with ASSR. Therefore, a combination of ABR and ASSR threshold complements the evaluation of auditory sensitivity. The ability to measure auditory steady state response threshold in patients with absent ABR is beneficial for cochlear implant evaluations. ASSR testing provides threshold information in the 90 to 120 decibel range of hearing loss. I repeat, ASSR testing provides the threshold information in the 90 to 120 decibel range of hearing loss, where amplification is not beneficial. On the other hand, ABR is a test of exclusion for these children to demonstrate that hearing is worse than 90 to 100 decibel without giving the exact level of hearing. Now, that is the benefit of auditory steady state response measurement, showing hearing residual presence at around 90 to 120 decibels. Now, this is the auditory steady state response equipment wherein the electrode are placed on the scalp.